The last dynamic sign we will discuss that can be used to identify a pleural effusion is the fluid color sign. Any movement of fluid can be translated into a Doppler signal. The fluid color sign refers to the presence of color signal within the pleural fluid collection that arise from movement of the lung within the effusion caused by transmission of respiratory and cardiac motion. As was previously reviewed in the vascular curriculum, the sensitivity of the Doppler should be set so as to detect low flow velocities. This is accomplished by adjusting the color Doppler scales to a low setting, typically lower than 25 to 30 centimeters per second. The fluid color sign can be useful when trying to differentiate pleural thickening from small pleural effusion, as both conditions may have a similar ultrasonographic appearance on 2D imaging as shown here. The presence of the interpleural respiratory variation and the presence of a positive fluid color sign are consistent with that small hypoechoric area being a small pleural effusion. On the clip on the left, the absence of an interpleural respiratory variation and a negative fluid color sign make the diagnosis of a small pleural effusion much less likely. However, have in mind that despite being less likely, a diagnosis of small pleural effusion is not necessarily ruled out when the fluid color sign is negative, as the absence of a Doppler signal may represent a false negative. As was previously seen in the curriculum on echocardiography and on vascular ultrasound, Doppler ultrasound can have many potential traps and pitfalls, and the operator using this modality needs to be aware of those pitfalls. These will not be reviewed again in this curriculum.